So welcome to our presentation on identifying and navigating the system of care. I am Stacy Smith, and also with me is Leona Oakes.
Thank you, Stacy. And so we're going to talk about the two primary systems of care in New York State when we're thinking about people with developmental disabilities and mental health. There tend to be directions that we follow for that. So Office for People with Developmental Disabilities, or OPWDD, tends to focus on those with intellectual and developmental disabilities, while Office of Mental Health, or OMH, focuses primarily on people with mental illness. I think it's really important to note that both of these offices have the same motto, which is that they are supporting people to live, work, and take part in their community. Their focus on who they're supporting is different, though there is significant overlap in those populations, of course.
So when you're going through, it's kind of difficult to figure out what system of care do I seek out. So OPWDD, which is the Office of People with Developmental Disability, is primarily concerned with people with developmental disability and intellectual disability, cerebral palsy, Down syndrome, Prader-Willi syndrome, autism spectrum disorder, and neurological impairment. But it is also important to note that autism and a neurological impairment also require proof that these disabilities interfere with adaptive functioning.
In contrast to that, the Office of Mental Health really supports people with at least one mental health diagnosis. So that can be something like disruptive mood dysregulation disorder, separation anxiety disorder, PTSD. That diagnosis, again, similar to OPWDD, must interfere with everyday functioning, or people that have two or more diagnoses are more likely to be eligible for some of the more involved supports of OMH, or the Office of Mental Health.
The Office of People with Developmental Disabilities, OPWDD, is how you would normally hear it referred. Um, is the if this is the right service for you, things that can be provided is family education, respite, community habilitation, day habilitation, pre-voc services, supported employment, and also things like adaptive devices to help with communication or just helping with everyday access, environmental modifications like ramps or bathroom accessibilities or lower counters, different behavioral services, in home or agency based, and also residential services. Um, it is important to note that you would need to go through the front door, and this is through OPWDD's different regions. There is 5 regions in New York State. Most of our knowledge, my knowledge about OPWDD is in Region 1, Western New York / Finger Lake area. So there are 3 steps of eligibility. The first step is they review your different paperwork that is provided for them to see if you are eligible, or you will get provisional eligibility. If you are determined eligible at this step, you'll just get a notification that you are eligible. If not, then it'll go on to the next step, which is a committee of clinicians that again review your eligibility. And if they agree, they will send out a notice of decision saying you are eligible for services. If you don't qualify at this step, then you do have one more step, and this goes to a clinician, license-based clinician that is outside of the committee of clinicians and outside of OPWDD, and then they do an assessment review, and then they make a recommendation to OPWDD on whether or not you should be eligible for those services. So if you are deemed eligible, your first step would be to hire something like a foreman when you're building this house, and that would be a care manager. And there is agencies called the health home care managers. Um, and in these care managers will help you to develop a life plan, which you will follow to say what you would like to services you would like to get, goals you would like to meet. They will help you to one get those services, medical services, and keep you completely informed on the services that are out there and the different health services that you have access to. So this slide is how you organize the funding to set up your services. So the HSBC waiver, the home and community-based waiver, allows you to utilize your Medicaid funds to pay for things that are not normally covered by Medicaid, i.e., which are not medical services. So this just allows Medicaid to pay for those services. So examples are things like respite and or community rehab. So this is the we're going to talk about choosing different services. So you'll have conversations with your care manager. You let them know things that you are hoping for, and then they'll help you understand what services are out there that can help you meet those needs. So some of these services might include a self-direction budget, which allows you to have a little bit more control over the services that you receive, or you can go agency based where you reach out to a different agency to provide those services for you. Um, Most of these services are examples to help you develop independent skills so that you can one day live on your own or do things as independent as possible. It is also important to know setting up these services is a lengthy process. You have to go through eligibility. You have to sign up for a care manager. You have to apply for the home and community based waiver, and then you have to reach out to get these different services, whether it's set up the self direction and or contacting agencies to provide you with those services. Um, so it is important to try and get this process started as soon as possible. OPWDD offers services to individuals as young as 3. So if you are eligible for OPWDD services, you can get those services at as young as 3 years old.
And many people, if I'm correct, Stacy, might wait until they're at transition age, thinking about adulthood, to think about OPWDD services because they've been served very well in their school system. But because this process can take so long, we encourage people that if they think they'll ever need OPWDD services, it's really important to apply as soon as they think that they might need them in the future. And as someone who diagnoses people in adulthood, there's an additional burden if we're applying for OPWDD for the first time in adulthood to prove that this developmental disability has always been there, has always needed support from the time that person was a child. And that can be difficult to prove depending on records and things like that if we're only applying in adulthood. So applying in childhood is a smoother road, if you will. All right, now we'll talk about New York State's other big umbrella of care, which is the Office of Mental Health. So this is really focused on those with serious mental illness that interferes with their ability to function in the community, home, and school or work, of course, depending on the age of the person. They offer different things for different age groups. So for child and adults, they both they offer health care coordination, whether that's through health home care management, which is associated with those that are eligible for Medicaid, or non-Medicaid care coordination for those that have private insurance. For children, they focus a lot on skill building. That skill builder can come to the individual's home or meet them out in the community. So that can be very helpful to children that need more help with generalizing their skills to different environments. Youth peer mentoring is also something really special that they offer so that the child can have good examples to look up to, peers that have been there and know what it's like themselves to go through different difficulties. And then they do have residential settings if that is needed for the child to be in a more therapeutic environment, as well as community residences. And then similarly for adults, the care management is where people start. And then there's assertive community treatment services that's similar to both skill building and some youth mentoring, where it's usually another adult going out with the adult teaching them how to do things, helping them get identification, for example, helping them learn how to navigate public transportation systems safely, as well as mental health residential services for those that are not ready to live in an independent apartment and need a little bit more of a therapeutic environment. Now, to access these services, all individuals in New York State would go through the single point of access. Now, the specific process and what that looks like varies widely by county. And so for Monroe County, children and youth have just a few forms. So there's one form called community-based services form, and that's the form you fill out and you check off whether you're interested in care management or care coordination. I always encourage everyone to get a care manager or care coordinator if they can, because that's the person that's going to help you figure out what else you might need and line up those services for you, whether that is skill building, youth peer mentoring. They could help you apply for residential settings if that's appropriate for the child and their family. And so it's really a key piece to have that care manager or care coordinator on your team. And that goes the same for adults. Adults have the referral for care management form, and it's either for behavioral health care management or health home, again, depending on whether or not they have Medicaid. There's separate forms for applying for that assertive community treatment service and for adult residential services, but those can also be completed with the help of their care coordinator if they set that up first, and that's really beneficial.
So now we're gonna give you guys a small, short, easy quiz. I'm gonna read over a couple things about this individual, and we're gonna decide what route we should go. So this hypothetical individual, Janae, she is a 21-year-old woman. She lives at home with her family. Like most people her age, she is figuring out what her next steps into adulthood. She is diagnosed with autism spectrum disorder and has intellectual disability. She has some aggressive behaviors that may be expressions of anxiety that have improved with intervention but are still present occasionally. When confronted with unexpected change during transition to non preferred activities and when visiting with less familiar people, she is also transitioning from school age services to adult services. So I'll give you a little bit of time to think that over to try and decide what route she should go. All right. So normally, if we were actually having a discussion, we'd be able to discuss it. You'd ask some questions, but we don't have that luxury. So, spoiler alert, here is the answer. Janae would be best served if she went through OPWDD to get services.
I think some things that are important to highlight there are the fact that Janae's primary presentation is as a young woman with both autism and intellectual disability. And I think that's what makes it more of an OPWDD path for Janae than an OMH path. Would you say that's true, Stacy?
Yes, I do agree with that.
All right, and another little quiz for you. We have Elijah. He is an 8-year-old little boy, lives with his mom, dad, and older brother. He attends his local middle school, has a 504 plan. He was diagnosed with autism spectrum disorder at 3, and he had language delays at that time, but they've since resolved. So his speech is more typical. He's been showing some signs of anxiety as he gets older. A lot of these are anxieties that present as we would expect them to present for an individual on the spectrum. So his morning routine is increasingly specific and controlled. He's very well behaved at school, but is starting to ask to go to the nurse for headaches and stomach aches. If the teacher tries to encourage him to stay in the classroom, he may start to hit himself in the head, he may hit himself in the head or start to shout his request. I see there's a little typo on that slide, my apologies. And these outbursts at school where he's starting to yell back at the teacher or really complain about physical symptoms are starting to increase in frequency and severity. And then we're also seeing emotional outbursts at home after school, where when asked to sit down to do homework, this tends to trigger shouting, slamming doors, and maybe breaking things in his room when he's very upset. So similar to Janae, we'll give you a minute to think about the best course for Elijah, the next path for him. A minute always feels so much longer when we're just sitting in silence. So spoiler, Elijah's strengths and needs would be best met through either community mental health supports or the Office of Mental Health, depending on where his severity begins to move towards. And the big highlights there are that while he has autism, his primary symptoms that are interfering with his functioning at school and at home are based on how he expresses his anxiety.
Um, so Janae has also been enrolled in OPWDD since she was 9 years old, at the school's recommendation. She did receive a lot of services from school. There was some outside services that also could be helpful. So parents started through the process. She went through the front door. She started with the home and community-based waiver. Family uses family reimbursement to help cover cost of supporting an individual with an intellectual disability, such as sensory items, safety items, and respite care. They receive in-home behavioral for some of her behavioral struggles, and they also get in-home and after-school respite just to get a little bit of a relief from her care when they need to like run errands and stuff, things that might be a little bit more difficult to do with Janae. Um, she also has access to the recreational respite for socialization. So that allows her to go to some place where she can have a caregiver, but also socialize with people that are more aligned to the different things that she is used to. She also utilizes the respite over the summer. She can use until she's 21. There are some for adults, but they are few and in between. Services she is planning to transition to after she graduates high school is the community hub, which will help her develop things like money skills, interpersonal skills, and different daily living or independent skills, like developing cooking skills and shopping for herself. She would also like to use a rehabilitation program, and the type of program she would like to use is without program, and this will allow her to not only attend the day program, have staff with her, but she'll be able to get to interact in the community a lot more frequent. She would also a pre-vote program, which this will allow her to develop those soft job skills, those things that a lot of us take for granted, like how to dress when going to an interview, or how to fill out a resume or an application, things like that, that she still needs those skills, but are not pretty much something that you would pick up at, like, say, a supported employment where they help you actually look for those jobs. Um, all of this decisions will be made in honor of her goals. And eventually, at some point, she would like to live on her own. And at that time, she can utilize the individual support services, which will help her to pay rent, and allow her to be in a place that is completely on her own, or someplace that's in a supportive apartment with a little bit of supervision. So she can still have a staff, but it's not somebody that is completely one on one with her.
In contrast, Elijah is not likely to be eligible for OPWDD services because his the elements that are primarily interfering with his functioning are more mental health based. So anxiety should really be the focus of his treatment, although ASD will be the lens through which his anxiety is understood, and especially how he presents his distress to the world. So mental health supports for anxiety are the first step, and that also goes hand in hand with behavioral supports for creating a more comfortable environment at school and at home, for making things more structured to help support him when he's feeling more anxious. And so Elijah's path will vary quite significantly by his severity. If his symptoms stay in the mild to moderate range, if he responds early on to working with a therapist, if his school and parents are able to work together to really build up supports cohesively around him, then it's very likely that that's where he'll stay. He'll probably have a community therapist working with him, maybe on some modified cognitive behavioral skills to look at new coping skills. Maybe his 504 plan will be updated to create some more structure in his school day, maybe make sure he has a schedule or is told about changes ahead of time. And then, of course, there are likely to be some supports at school that he can use, like social skills groups that will increase his success in peer interactions to help build up his self-esteem. And then we want to look holistically at Elijah as well. So we might identify some sports or clubs that he can join to, again, provide a positive social environment and some good peer models. That can really go a long way to decreasing anxiety in a young person. Now, if Elijah's symptoms move more to the moderate to severe range, where he is having a very hard time functioning at school, a very hard time functioning at home, those skills just aren't clicking for him, that might be when we initiate accessing the Office of Mental Health fuller supports. So that might be when a SPOA application is completed to get him a care manager that can help us look at what other supports are available, maybe some skill building that can go into the home to really help coach the parents, look at the environment, figure out how best to respond to Elijah's need, maybe a youth peer mentor that's, again, someone that has been where Elijah's been, is kind of like a big brother for Elijah to look up to, that's really focused on a therapeutic relationship. And then we might, at any point, choose to go from a 504 to an IEP, but especially if symptoms are more moderate to severe, an IEP can provide much more robust supports, and might especially be used if we're considering an alternative school program for Elijah. So of course we have our two service systems of support, kind of like safety nets, to make sure that everyone is covered, people are able to access their community and hopefully live a life that feels fulfilling and joyful. And those two main systems of support are OPWDD and OMH, as we've just talked about. But we also need to acknowledge that those two nets have a gap in between them. So whether you're an individual on the spectrum that has full language, typical IQ, but is still struggling to learn those unspoken rules about society, and you're struggling to find the right community support, and neither of these systems, you don't qualify for any of the big systems. So how do you find those supports for you? Individuals with fetal alcohol syndrome can also fall in that area, where maybe they're fetal alcohol exposure wasn't really known until they got older, but those executive functioning deficits are really there. And now that they're older and the demands are to be more independent and to regulate themselves a lot more, they don't fall into any system of support, but they still need support. And fortunately, that is where, this will vary widely by community, but there are community services that are available that don't need necessarily a whole system to get involved with.
So these two systems, obviously, like Liana said, don't have that little bit of gap, and there are community resources out there, and they're not as well known, but there are community mental health providers, places like clinics, and there's also independent practices. Like here in Monroe County, we have something called the Spotted Rabbit Studio that helps with therapy around the different arts and stuff like that. And then their individual providers and private practice. Agency based. Some of these services are offered through OPWDD, but are not exclusive to those with OPWDD services. So the Peters Family Life Centers, which is now called Heritage Christian Services, they have services that can be utilized, lifetime assistance and Easter seals. Some of these services can be utilized through family funding and or insurances. Other places, exclusive organizations and events like the Rochester Accessibility Adventures, local YMCAs and libraries. They do events and days for individuals that are focused on sensory friendly movies and different events. And museums are geared to all, and there are some museums especially in the Rochester area, that are geared to that self direction and understand that individuals with disabilities may need a staff, so that membership covers the individual, but also covers them to bring a staff with them. And they also sometimes do things that are focused towards that population and have sensory type days, like at the Museum of Play.
And so, of course, the pros and cons of accessing these community resources is there's going to be a huge variety, a wider group of peers to work with, a wider group of models, a lot more opportunities and different types of services. But there's also that added burden of the individual and their family needs to seek these out themselves and organize them themselves and set them up. So there's pros and cons to that, but there are programs and services available. It just takes a lot more footwork to get there. Now, of course, if you are a provider of mental health services for people with and without autism, and you're looking to learn more about how to support individuals with autism and mental health, we will have a mental health and ASD Echo starting up. And so an Echo is a team of experts. We are a team of experts on autism spectrum disorder, and we're going to help guide a group of mental health practitioners to build up increased competency, increase comfort with caring for patients with autism spectrum disorder. Because I always like to say, it doesn't take a specialist to do everything, and people with autism spectrum disorders can be well served by community providers. And so we will have 1 hour biweekly virtual meetings. There will be some didactic trainings around skill sets, but most importantly, there'll be case support where you can get some consultations on any clients you have that you've been working with and you feel like it would be helpful to get a broader perspective on. We really want to set this up as a professional network of local mental health providers that are supporting one another to use effective and evidence-based mental health services. So if you're interested in that, please contact our coordinator, Jennifer Ward. And like to make it clear, it's Jennifer_Ward at urmc.rochester.edu. Thank you so much for listening.
Thank you.
Okay.